How can I get an accurate pancreatitis diagnosis quickly? If you're experiencing sudden severe upper abdominal pain that radiates to your back, nausea, or vomiting, you might be worried about pancreatitis. Getting a quick and accurate diagnosis is essential to start proper treatment and prevent complications. The process usually combines a few key steps guided by medical standards. First, a healthcare provider will take a detailed medical history and perform a physical exam. They will look for signs like tenderness in the upper abdomen and check for other symptoms that suggest pancreatitis. Next, laboratory tests are crucial. The most important test is measuring serum lipase levels, which tend to stay elevated longer and are more specific for pancreatitis than amylase. If your lipase is more than 3 times the normal limit, it strongly indicates acute pancreatitis. Blood tests also include a complete metabolic panel, which checks liver function, blood sugar, and electrolyte levels, and a complete blood count to look for signs of inflammation or infection. Triglyceride levels are checked because high triglycerides can cause pancreatitis. Sometimes, urinary trypsinogen to testing is used, but it is less common. Imaging studies help confirm the diagnosis and identify causes or complications. The first imaging test often is an ultrasound because it is quick, non-invasive, and good at detecting gallstones, which are a common cause of pancreatitis. However, ultrasound can have limitations in visualizing the pancreas fully. If ultrasound results are inconclusive, or if there are signs of complications, a contrast-enhanced computed tomography scan is usually the next step. CORT scans provide detailed images of the pancreas, revealing inflammation, necrosis, or pseudocysts. They are fast and widely available but involve radiation exposure. Magnetic resonance imaging and magnetic resonance cholangiopancreatography are other options. They do not use radiation and are excellent at showing pancreatic and biliary duct problems. These are especially useful if CORT is not suitable or if more detailed images are needed. Endoscopic ultrasound and endoscopic retrograde cholangiopancreatography are more invasive procedures and are generally reserved for cases where non-invasive tests are inconclusive or when a therapeutic intervention, like removing gallstones, is planned. ERCP carries some risks, so it is not used solely for diagnosis. To meet the criteria for diagnosing acute pancreatitis, at least 2 of 3 things should be present: typical abdominal pain, serum lipase or amylase levels more than 3 times the normal limit, or characteristic findings on imaging tests. Combining rapid serum lipase testing with an ultrasound can give quick initial results. If further confirmation or evaluation of complications is needed, a CORT or MRI can be performed promptly. Early diagnosis is especially important because ongoing inflammation can increase the risk of developing pancreatic cancer over time. Remember, always consult a healthcare professional if you suspect pancreatitis. They can guide you through the appropriate tests and help determine the best course of action based on your individual health situation. Getting diagnosed quickly and accurately can make a big difference in managing symptoms and preventing long-term issues.